Cancer screening programs in Australia have seen death rates fall over the past few decades, but there's more to be done, particularly when it comes to culturally and linguistically diverse communities. Dr. Usha Salagame is a cancer researcher and member of Pink Sari, which works to increase cancer screening among South Asian communities in New South Wales. And she joins me now in the studio. Dr. Salagame, welcome. Now, there is more work to do, particularly in our called populations. How big is this gap that we're seeing in screening rates?
Thank you, Gemma. We don't have exact recent data on screening rates by, say, country of birth or ethnic groups. But we do have some data which indicates that areas, especially around greater metropolitan and outside Sydney, which have lower rates of screening, have a higher percentage of overseas-born members of the community and people with languages other than English, whom we call as culturally and linguistically diverse communities. I would say that when I've looked at the data available for breast and cervical screening rates, there's a difference of about 7 to 8% compared to the national average.
Now, when we look at the barriers, there are layers, and it starts, as my understanding is, with an awareness of what is available in terms of those screenings, and also for these people to put health as a priority. Tell us about that.
There is definitely a lack of awareness around especially the national screening programs that are available, the breast, bowel and cervical screening programs. Many of the people come from countries where there is no such program. So it takes a little time for them to understand this concept of public screening. What was the other question?
And, you know, putting health as a priority. There's,
yes,
you know,
definitely.
a lot to deal with
yes.
in a new country, and
exactly.
it's not a high priority sometimes.
You said that, exactly. There's a lot to deal with. Often people who come are younger, and from their limited knowledge, they think cancer is not a big issue in younger people. And they have a lot of competing priorities: settling in a new country, becoming financially stable, young children, long commutes, mortgage, the list goes on. And going to a doctor when there are no obvious symptoms is not embedded in those cultures. And so it seems to be not at all a priority at that point in time.
And the next layer of barriers, it's more complex. So it speaks to reputation and honour. There is guilt and shame tied up in this. And of course, every community is different within that. Can you tell us a bit about this, though?
Yes, there is some amount of those aspects. That varies a lot by the socioeconomic status of individuals within the community, their overall English and health literacy. Culturally speaking, there are some barriers about speaking about diseases, and those kind of things are kept within the family. There's a guilt associated with cancer diagnosis that I might not have done something right. There's also the concept that going for screening is inviting bad news. And also that my family comes first, particularly for women. And self-care is not seen culturally as a priority for women.
Do you think health professionals have enough of an understanding about those barriers that we've just spoken about?
Some do, some don't. It depends how much they have interacted with people from these communities. There's a lot of effort being made to educate the health professionals about these. Ethnic communities, when they go to a health system, they already carry a lot of anxiety with them. There are some hearsay anecdotes in the community about how they have seen patronizing behavior. There are communication gaps because of language barriers. And so there is an effort being made to educate the health professionals.
And how do organisations like yours, in addressing these barriers, you know, tailor those messages? And I mean, could you do with some help in this with that communication?
Oh, we could definitely do with help. And I come from Pink Sari Inc. Pink Sari Inc. has been working tirelessly to promote screening rates among South Asian women since 2016. And we are entirely a voluntary community. We do get grants now and then from Cancer Institute New South Wales. And we try to work within the grant. They're small amounts, but we try to work within them. We also work closely with the Multicultural Health Communication Services, MHCS and New South Wales Health. So we could do with not only us, there are similar organizations among Arab communities, among Chinese communities, and we're all trying to do our bit and create awareness within our respective communities. Creating in-language resources, more widespread publicity and those kind of things can help. And listening to people like us who make what's available accessible. So it's available, but it has to be accessible, and we people like us work to bridge that gap.